In medical practice, there are often cases when people who do not experience obvious symptoms seek preventive examination at the age of 40-65 years. During such examinations, hidden pathologies are often discovered, which, despite the absence of current complaints, may worsen the quality of life in the future. Many of these conditions, perceived as an inevitable consequence of aging, are actually amenable to correction and prevention. One of the most common findings during such examinations is atherosclerotic plaques in the carotid arteries. The presence of even small plaques, especially with signs of ulceration of the arterial wall, indicates the risk of atherosclerosis in other vessels. Although the visualization of plaques in the vessels of the brain can be difficult, their presence can be detected by examining the abdominal aorta, iliac and femoral arteries. The next factor identified during the examination is a change in the stiffness of arterial vessels. There are techniques that allow you to objectively assess the elasticity of blood vessels, for example, measuring the stiffness of the carotid artery. Vascular elasticity decreases with age, which is a natural process. However, many people experience a more pronounced decrease in elasticity than is appropriate for their age. This may serve as a signal of an increased risk of cardiovascular disease. Another common finding in people over 40-50 years of age is a decrease in diastolic heart function. Diastolic function, which is responsible for the ability of the heart to relax and fill with blood between contractions, can also suffer with age. However, many people over the age of 60 retain good diastolic function. This suggests that this condition is not always inevitable. Relaxation of the heart, called diastole, plays a critical role in the normal function of the cardiovascular system. If the heart does not relax well or experiences diastolic dysfunction, the ventricles do not have time to fill with the necessary volume of blood, which subsequently prevents the effective release of blood into the vessels. Diastolic dysfunction is an adverse condition that can progress over time. One of the most common factors affecting the cardiovascular system is high blood pressure. More than half of people over the age of 50 have blood pressure above 138 mmHg. Despite the fact that some consider 140 mmHg to be the norm, it is important to strive for lower values, 128 mmHg, to maintain heart health. An increase in systolic pressure by 10 mmHg increases the risk of developing cardiovascular diseases by half. Another factor that is common is fatty hepatosis. Many people with a waist size exceeding half their height have fatty hepatosis. The normal waist-to-height ratio for men is no more than 0.52 and for women 0.48. Fatty hepatosis increases the risk of developing insulin resistance, steatohepatitis and even cirrhosis of the liver. The accumulation of fat in the pancreas, known as steatosis, is also a serious problem. Steatosis can lead to pancreatic dysfunction, pancreatitis and disruption of its hormonal function, which can cause excessive appetite and weight gain. Changes in blood tests, especially in the lipidogram, often indicate problems with the cardiovascular system. A lipidogram is a laboratory analysis that determines the concentration of key lipids and their fractions in the blood, which play an important role in the metabolic processes of the body. The analysis includes the determination of the following indicators: total cholesterol, O, which is the main steroid involved in the formation of cell membranes, hormone synthesis and other vital processes. The liver, the main organ of cholesterol synthesis, produces about 80% of O, the remaining 20% comes from food. High-density lipoproteins, HDL, which function as transporters of cholesterol from the body's cells to the liver for further metabolism. They are often called good cholesterol, as they help to remove excess cholesterol from the bloodstream, reducing the risk of atherosclerosis. Low-density lipoproteins, LDL, which are the main carriers of cholesterol to the cells of the body. Excess LDL in the blood can be deposited on the walls of blood vessels, forming cholesterol plaques and contributing to the development of atherosclerosis. They are called bad cholesterol. Triglycerides, TG, which are the main type of fat in the body, are used as an energy source. An increased content of TG in the blood may be associated with the risk of developing cardiovascular diseases. Cholesterol, being a fat-soluble substance, is not able to be transported independently by blood. Therefore, in the body, it is packed into protein containers, forming protein-lipid complexes known as lipoproteins. The risk of developing atherosclerosis depends on the ratio of good and bad cholesterol. Many people over the age of 50 have elevated levels of low-density lipoproteins, LDL, which increases the risk of developing atherosclerotic plaques. In clinical practice, there is a widespread tendency to a violation of the lipid profile in a significant part of the population. The level of low-density lipoproteins, LDL, often exceeds the reference values, often accompanied by an increase in triglycerides and very low-density lipoproteins, LDL. In addition to lipid spectrum disorders, many patients have a significant deviation in insulin levels from the desired parameters. According to generally accepted medical standards, the insulin level should be below 5 mol per liter. However, in a significant part of the population, insulin sensitivity is reduced, which leads to an increase in insulin levels. When the insulin level exceeds 25 moles/liter, insulin resistance is diagnosed, requiring the attention of specialists. It should be noted the importance of assessing kidney function, which can be determined using cystatin C analysis. Cystatin C is the most accurate marker reflecting the functional state of the kidneys. With age, there is a decrease in renal function, which is manifested by an increase in the level of cystatin C. It is important to emphasize that the above-mentioned disorders are the initial stages of pathological processes that are not always accompanied by pronounced clinical manifestations. In most cases, people do not experience significant inconveniences while maintaining an active lifestyle. However, these disorders signal the beginning of destructive processes in the body, which can later lead to the development of serious diseases. Despite the inevitability of aging, there are factors that affect the rate of development of pathological processes. Currently, there are a number of programs aimed at correcting metabolic disorders and slowing down aging. However, unfortunately, only a small number of people adhere to the recommendations of these programs due to insufficient motivation or lack of awareness of the importance of preventive measures. It should be emphasized that only the person himself can influence the state of his health in the early stages of the development of pathological processes. It is important to pay attention to changes in the body and take the necessary measures to correct them, but you also need to take into account that you always need to consult with your doctor.